Father? Oh, they born him here, but he lived his age before he died was 75 years.
That's his motorbike?
Yes, that was his motorbike. In here.
On February 23, 2022, Hussein Zakari passed away in his home at Nantonzo in the northern region. Per Islamic law, he was buried the same day at a local graveyard. Mr. Zakari left behind a wife and 4 children. Yakubu Zakari, his son, and Salifu Husseini, his brother, are at the cemetery today to pray for Allah's intercession 4 months after their father and brother's passing. At the Tamale Teaching Hospital, the 75-year-old man was diagnosed with kidney failure. Doctors told the late Zakari to stop drinking from the primary source of water in the community. Many residents were alarmed by the doctor's advice as they assumed the dam water was to blame for Zakari's kidney failure. At the family home where the late Zakari passed away, we met Yakubu, the deceased eldest son, who was caring for his father both at home and at the hospital. Though Yakubu cannot find any hospital records, he assessed that the doctors told him his father's advanced kidney disease was caused by his continuing drinking of the dam water.
They carry on tests upon tests, so they carry on several tests before they conclude it was waterborne disease. That leads to the kidney failure.
I asked more questions to confirm Yakubu's assertion.
That was through their tests and the examination or the experience they already have. So that's how come they told us it was unsafe water he is using. They didn't actually tell her before the thing got worse. It was just the beginning that they told her not to give him damp water again. All of us were using it. So what we've seen or what we saw make us so scared. So we don't like to use the damp water for drinking again unless using it to wash and then bath, because we've seen what it has caused to us. Yes.
The family then decided to buy bottled water for late Zakari, but the cost was expensive for them.
Just during the sickness, they even told us not to give him damp water. So they emphasized us to be using Voltic, and then which is a little bit cost for us, because as the community we are living is not all that decent. So we struggle, but we manage our best. Throughout the sickness, we're no more giving him damp water. We try to give him sachet water or Voltic. That was what we were using.
The agony and suffering of a kidney disease, which is probably becoming more widespread among Ghanaians, were too much for Yakubu's father to bear. Yakubu's claims needed further interrogation. Residents have complained and blamed this water for their poor health condition. But the only way to confirm this claim is to test and analyze the water. A sample of the dam water was taken on June 15, 2022 and delivered the same day to the Ghana Water Company Limited's Water Quality Assurance Department in the northern region. The analysis established the water source is unsafe for drinking.
With this, instinctively, when you see it, you know that it's not potable. But then you cannot be carrying this sample around showing people that this is the way the water look like. The best thing is to analyze, turn this water into a data form, and that is exactly what you have done. So this now represents this. The results now represent the water, and if you look at the results clearly shows that the water is not suitable for human consumption, because the physical and chemical parameters doesn't support or doesn't obey the regulatory requirement. And if you look at it, we have Ghana standards. Whatever sample you analyze, the results must conform to regulatory requirements. That means that the results should show that when human beings use this water for domestic purposes, the water will not be injurious to their health.
Here are the findings of the physiochemical and bacteriological analysis performed by Suleiman Al-Hassan, manager of Regional Water Quality Assurance.
In terms of physical appearance, it's not good. Chemical appearance, chemical composition is not also good. And the worst is even the microbiology aspect.
According to the analysis, it is impossible to count the microorganisms in the water.
When we did the analysis, we realized that ideally you count the number of microorganisms in the water to tell you the level of contamination. Even for purposes of human consumption, you don't even bother to count the number of microorganisms, because ideally the water shouldn't contain microorganisms. So once you see it, if you go ahead to even count, you want to determine the level of contamination. But once you see microorganisms, it means you cannot use it. But what is the extent of pollution? That is why you now go ahead to determine the numbers. Unfortunately, when we did your analysis, we realized that we can't even count. That is why we put TNT, too numerous to count.
I questioned Mr. Al-Hassan about the fundamentals of water quality assessment and the consequences of consuming contaminated water.
Of course, the reason for doing water quality analysis is to be able to tell whether the water can cause injury to human life. And when we are talking about injury, we are not talking about instant injury. Some come as a result of long-term usage. Are you getting me? So if you are using this water over a long period of time, there are some who may even begin to show symptoms of consequences within a very short period based on their immunity.
The findings indicate that anyone who continues to drink the water would have health issues.
Because the water that you are treating should be friendly to people of different immune systems. We call some people immunocompromised people, those who immune system is compromised. Example is an infant, a baby, a tiny baby, an elderly person, a pregnant woman, sick people. These people, their immune system has already been compromised. So when they are using this, the consequences is dire and quicker than somebody like who appears to be healthy. That one, it will take time. So once the person takes this continuously and is not treated, you get varying degree of injuries.
But because Mr. Al-Hassan was unable to precisely connect the findings to Yakubu's claims, we were compelled to go to the Tamale Urology and Modern Surgical Center, which is located in the center of Nantonzo. The facility, constructed by Lemet Ghana, a Tamale-based non-governmental organization, trains urologists. It is unique to the nation and offers specialized medical services in urology as well as surgical support. We first presented the analysis to Dr. Akiz Afoko, a consultant urologist who is also in charge.
The report shows that the water contains a heavy load of salmonella, which often causes typhoid fever. And I can say a third of children are admitted to hospital from the community for this reason. It also contains E. coli. The impact or the significance of this finding is that these bacteria are actually transmitted through human excreta. So it means human excreta gets its way directly into this water. It's a fecal-oral mechanism of transmission, and if we have this heavy load of bacteria to the extent that the report says they're too numerous to be counted, It's just such a heavy load, the colony forming units cannot even be counted. And indeed, such water is very, very unsafe for the whole community.
Dr. Foko says many residents report at the facility with severe cases of diarrhea.
Yes, so basically, even if you take a school child, for instance, if in a couple of days they have to be off school because they had diarrhea, and many of the community members are coming with, sometimes severe diarrhea, sometimes bloody diarrhea. And indeed, typhoid fever can cause perforation of the bowel that necessitates surgery. It's a very common cause of peritonitis, which is having a high serious morbidity and high mortality rate. And salmonella in the water means that even if you use it to wash vegetables, you're going to have problems, And if you're drinking this water, you're going to have serious problems.
I put Yakubu's claims to Dr. Foko.
Yeah, so I guess you're talking about Father Zakaria, who is our father, our late father and brother, and revered member of the community. Yeah, indeed, he had a serious infection, and it resulted in renal failure. What usually happens is that sometimes when you have these infections, you may have your body producing some antibodies. And these antibodies, even though they are trying to fight the disease, they also fight the body, and eventually they damage organs. Sometimes it could be the heart, but often it could be the kidneys. The substance of the kidney is similar to the antigen of the bacteria. So the body now starts attacking, so he actually had a kidney problem for some time and went into terminal, renal failure. And then, we lost him. Hydration. You can imagine if you have kidney failure and then you are having diarrheal disease, you are dehydrated, you are losing electrolyte. The electrolytes are already in a state of imbalance when you have kidney failure, And once you go having a diarrhea again, then the electrolyte levels are even more deranged, and sometimes, most often, you can't recover from that.
So it's likely that it's possible that somebody can die and get kidney.
Sure. As I said, in the case of Father Zakaria, it was the case that he ended up with chronic, kidney failure. The thing is that there are also all kinds of other pollutants, because if you see the bed from where the water runs into the pond, there is no control over what. So even pesticides, which are sprayed upstream, are all running into the water body. Weedicides are all running into the water body.
Dr. Foko says bladder and kidney cancers are common. The ages of the victims worry him.
Yeah, so actually the bladder cancers and kidney cancers are quite common, and as I said, the thing that is ringing an alarm bell is the fact that the age, the age of incidence and the age at which people are having terminal cancer is so strikingly low. In the places where these cancers are common, they see it, when you're about 60 to 70 years. And we are seeing it even in people who are not yet 20 years. And by 25, 26, they are already in a terminal stage. The cancer cannot be operated. Apart from that, actually, kidney stones are so common. I just have a whole collection of kidney stones, And the kidney stones, indeed, last week we had a child of 7 months with a kidney stone. I mean, that's, not to talk about the older ones, So kidney stones are another problem, apart from the cancers. Also, renal failure, as I said, is something that is common. and can be attributed to many, many conditions. But the age at which you are seeing this is also another problem, because the younger people are having these things. And as I said, also the congenital malformations that we are seeing, like children are coming without the testes descending into the scrotum, or the penis didn't form properly, These are really issues that we've been documenting.
He says data from the community due to the drinking of the damp water is overwhelming.
Because I'm research-oriented, I'm sitting here with a lot of data, and it's frightening because apart from the direct impact, getting them ill, having diarrhea, going to hospital, dying from it, also the younger people in the community, but certainly in this community, people are having deranged semen analysis, Younger people are having smaller testes than older people, And what is the future of any community or any town or any country if out of pollution from plastics, from pesticides, from, you're now not able to reproduce? Nobody is going to shoot a gun and take your country. They just wait until you can't reproduce. The plastics pollution, which is affecting our water body, and also the pesticides, are all disrupting hormones and the endocrine system.
Dr. Afuku also spoke about the testicular size of residents due to the continued drinking of the water.
So, for instance, just by using the ultrasound machine which we have, we can measure the testicular size of people who are adults who are below 35 years, and we also measure testicular size of those who are above 60 years. Indeed, we do community screening, so yearly we have a plan for for Nantonzo and surrounding communities where people come and we have their records, and then we just check. We check their kidneys, we check the testes, we scan when we find something, unusual. And actually, we found that, if you just look at the testicular size of those who are 35, adults who are 35 years or below, and you compare to adults who are older than 60, the older folks have larger testicular sizes, volumes. Actually, when you're an adult, once you're a grown adult, 20 years and above, the testis doesn't grow again. Indeed, above 60, it may even shrink a bit. So if the volumes of the older people are bigger, higher, than that of the lower, then something is going on. And we mark this with semen analysis, and you can see the difference for yourself. It's amazing that the younger people are having smaller numbers of, the semen, the spermatozoans. They are having smaller volumes, and then the motility is deranged in the younger people, and the morphology is also, abnormal, more abnormal forms in the younger people.
Dr. Afuku took our team around the hospital to look at some of the kidney stones collected.
Hundreds of them. This came from a 2-year-old, this stone. The real stone. Yeah, we are able to do some surgery without cutting the body. So this stone was broken with a piece of laser and extracted, without cutting the patient out. I think Afa Salifu might tell his story. This stone, actually, this is a Stockhorn calculus. This is a real stone. It's a real stone. Was taken out from a patient, 32-year-old patient who lost the kidney anyway, because it was a non-functioning kidney, so we didn't need to break it. We just took it out like that. So really problem from contaminated water and all that. And these patients are in pain. They are losing their kidneys because this kidney was lost to severe infection.
Fuseni Salifu, the younger brother of the late Fuseni Zakari, is horrified by the revelations.
I was saddened by what the doctor said about contaminated water and diseases it can spread.
Back at the dam, our camera captured children drinking water at the source. Residents say they are aware of the negative health impacts, but have no choice. Yakubu Habiba, for instance, has visited the hospital for complications. She has paid huge hospital bills in recent times. A few weeks ago, she paid about 600 cedis.
I spent about 600 Ghana cedis at the hospital. They gave me infusions and medications.
I inquired further as to what the doctor had told her.
The doctor asked me what I eat, and I told him, truly, it is this water I use. Then he said it was the cause of my sickness. My name is Zubeidu Hazifa, and I attend Ambaria SHS. We use this water for drinking and cooking. We use it for every purpose. As you can see, this is water. This is used by my parents, siblings, and everyone else for drinking and cooking.
Women and children spend at least 4 hours collecting a basic commodity that actually does more harm than good. Some residents have drank the water for more than 30 years. Zubeiru Musa is one of the opinion leaders.
I've been consuming this dam water for over 40 years, hence I'm afflicted. So you will keep drinking the water until you see a doctor who will then determine that you are sick. You will then require significant medical attention.
What might be the long-term solution for residents of Nantonzo? That is the question I asked Mr. Alasan, manager of water quality assurance.
The best method or the superior method that can be used to treat this water is conventional water treatment, which has to do with you having a facility that can first of all clean this water so that you will now separate the suspended matter, the color, the turbidity, all, and get clean water. Go ahead to now kill the microorganisms through what we call disinfection. If possible, you do pH adjustment, and then after that, you now test the water to see if the treatment process is optimum, is good, such that the finished water will not contain harmful microorganisms, chemicals that can be injurious to human life. When that is achieved, you can now declare the water wholesome. So with this, we recommend conventional method for treatment. But if there are other options like borehole drilling or underground water, you can drill a borehole and then maybe that one may not require so much treatment if you are lucky and the water table is good.
Borehole for the community, or several boreholes for the community. There is some underground water. I know it's quite deep, but I'm sure if we were able to get a borehole or two, and able to put a mechanism for pumping it out, that would greatly reduce the burden on the community and definitely reduce the burden of disease, on the children and elderly and, everyone in the community.
An immediate solution is what residents of this community need.
If I won't stop drinking the water, then it is because I have no option. But if I have a way, I will stop because I know the water is not good for my health.
I saw that given the current course of events explained by the doctor, the Zuo community is in danger. But how do we get out of this danger? We as a community have nothing if the wealthy people who can assist us do not do anything.
A report by Nurudeen.